Hello and welcome to this show. My name is Solusha Francis as always. Today we want to look at types of depression. In previous episodes, I talked about the difference between depression and sadness, where I explained to us how sadness comes in before depression sets in and how long it takes before you can deduce that you actually have depression, either by through clinical diagnosis or psychological diagnosis. And I made us to understand the importance of being able to differentiate between sadness and depression. And then I remember that in the last episode of this particular series, we looked at how depression it could be a secret that we all share, and I shared with us a video by Anthony where he was by Andrews, yeah, where he was talking about the fact that a lot of people go through depression and they're actually trying to hide it away from the person next door. Sometimes it could even be their spouse that they're trying to hide it away from. And so, in this particular episode, I think it's necessary for us to look at the types of depression that we may be experiencing. Now, the interesting thing is that there are three broad types, okay, that I'm going to be talking about today, and each of them manifest or show up at different times and different periods in our lives. The first one we'll be looking at is seasonal affective depression, SAD, seasonal affective disorder. Now, seasonal affective disorder is that type of depression that comes in at a particular season. It comes in that period where maybe the weather changes and you're feeling down emotionally. Things change and you're not comfortable anymore. You're moody and you're what we call ginger is no longer there. Yeah, so it is seasonal in the sense that it can come during summer and off during winter. It can come during winter and off during summer. For those in Africa who don't experience winter and summer, it can come during the cold season, the rainy season, and then go off during the hot season. So you realize that it's that type of depression that is tied to how the season is, a particular season of the year. In fact, research has it that it shows up during winter and is off during summer. So during winter, you have a number of people who are going through that particular disorder. You know, it is not something that is lifelong. It is not something that they had before that period of winter. But the moment winter sets in, they begin to feel down and they begin to seek help because they are not stable emotionally at that point anymore. Now, it would interest you to know that this requires a special form of treatment because it is temporary. It is not constant. It is not forever. It is just for that particular season. So it becomes necessary for them to seek help at that particular point in time. And because it is seasonal, they don't have to live on drugs for so long. They don't have to live on antidepressants for so long. Sometimes they don't even need medication. All they just need is just psychotherapy or cognitive behavioral therapy for them to pass through that phase. Now, how would you know that what you're going through is SAD? Simple. Look at that time of the year where you usually feel down. Pay attention to that period of the year where where you have your depressive moment and identify it. If there's a particular time of the year where you experience this, then it is clear that what you're going through is SAD. Now, what am I trying to say? It is very, very clear and needed that you pay attention to what you experience all through the year. Now, this would help you to ascertain if indeed you're depressed or if you're just responding to change in seasons. A number of people experience this and some don't. All right, I am not saying that this represents the fact that a person might be depressed or going through depression. No, there are people who are really going through depression, but the truth of the matter is, if you're able to pay attention to your feelings all through the year, and then you're able to identify what time of the year you experience this SAD, then to be clear to you what needs to be done. But if you do not pay attention to these symptoms or what time of the year they come in, then you may not really be able to know or deduce what exactly your depression, the type of depression it is that you're suffering from. Now, the next one is situational depression. Situational depression. Now, situational depression is a type of depression that is based on the situation you have found yourself. Now, when you hear people say, my boyfriend just left me, I feel so depressed right now. My company hasn't paid me, I feel so depressed right now. This weather is so cold, I'm so depressed right now. Someone just hit my car, I'm so depressed right now. It is situational. Now, it is situational in the sense that the depression that that person is going through at that moment is situational. And note that we had agreed earlier on that for you to say you're depressed, you must have gone through some moments of sadness over a period of time before depression can be said that you are depressed. Now, so using the word situational depression is in quotes, in the sense that this person cannot clearly say that he or she is depressed, but he or she is sad. Now, the truth of the matter is this person is sad, this person is unhappy, okay, this person is hurt, but this person is emotionally down, and so there's a change in mood. There is a feeling of there's a downtime. Let me put it that way. There's a downtime emotionally, and so this person feels, oh no, I am depressed right now. This person just did this to me. I just lost this. I just lost that. Now the interesting thing is, as much as this may seem like this person is truly depressed, the honest truth is the person is actually sad. Yes, trust me. The person is actually sad, and all that person needs at that point is to deal with the situation. And so this depression has come in because of the experience that this person is going through, or that this person has had not too long ago. So you hear something like, he told me he doesn't love me. He walked me out of his house. I feel depressed right now. I mean, how could he do such a thing? Now note, except over a period of time that feeling remains and that downtime remains, then what that person is going through is situational depression. But if after a while the feeling subsides and that person returns to normal, then you can say it is situational. So how do you then handle this? So you give this person, or you give yourself, some time to see if this feeling remains constant. Okay, now this doesn't mean you should not seek help. This doesn't mean you should not talk to someone, or an healthcare professional, a psychologist or a psychotherapist or thereabout. But what this simply means is you don't need to go headlong to take it hard on yourself. Okay, the situation you're going through or that you have gone through may warrant that you feel the way you feel. Okay, so it is important that you understand that whatever you're going through at that moment is situational. But after a while, if that feeling remains, then you can clearly say that you are actually depressed. Are you with me? So because it is key that we pay attention to the feelings and see how long it lasts. So you cannot wake up one morning and say, I am depressed. No, depression takes a period of time to manifest. Of course, it starts with downtime emotionally, where you feel sad or you feel even tired and all that, you're unhappy about yourself or what is happening around you. All right, but that is okay for that moment. But what now happens, or what needs to be done, is that you now pay attention for how long it lasts. Okay, so you're able to pay attention to how long it lasts, and then you can now clearly say that, oh, indeed, I am depressed, or I need to see a professional. So for situational depression, what is the situation that led to your downtime in terms of emotions? Your boyfriend left you, your girlfriend left you, your spouse beat you up, your spouse left you, you lost your job, and a number of other things. You got hit by a car and so on. But the key thing is you look at how long is this lasting? How long have I felt this way? If the feeling persists, like the doctor would say, if symptoms, if like drug manufacturers would say, if symptoms persist after 3 days, consult your physician. So you begin to look at it. If this symptom persists, then it is high time for me to consult someone. But if that particular feeling is just based on what has happened to you, is based on the situation you have found yourself, then it becomes very, very critical and very key that you handle that situation and see how you feel about yourself. Now, the next one I'd like to talk about is atypical depression. Now, the thing about atypical depression is it is not that type of depression that you can pinpoint that you have probably felt before, or this is how it's supposed to be. Now, depression can have a spectrum, and that we'll call maniac depression. Okay, so before now, it used to be called maniac depression, but I discovered bipolar disorder, in which the person is operating on two poles. This moment the person is jumping here and there, the other moment the person is down. All right, so this kind of depression belongs to typical depression, where you are not, you're between two extremes. Okay, now the interesting thing is you cannot actually diagnose or detect this yourself. Only a physician can, or a therapist or a psychotherapist can. Now the interesting thing is that when you realize that you go through this kind of mood swings, yes, that's what you call mood swings. When you realize that you're going through mood swings, then you pay attention to the mood swings. At what time does this happen? How long does this last? And seek help. Hi, so I hope you have found this particular episode interesting and worth listening to. In case you have enjoyed this particular episode or this series so far, please subscribe with the button below and click on notification button so that you can get notifications next time every video comes up. Please share this video with your friends, families and relatives and see that they watch it. If you need any help, please drop your comments below, ask your questions. I'll definitely answer. Till I come your way again, it's Tolu Chef Francis again. Bye bye.